This afternoon. Good afternoon and welcome to the 4 o'clock Board of Douglas County Commissioners work session for December 20th. We're sorry we're a little late. We had some technical difficulties getting started here, but we're glad to get started on an update from the Lawrence Douglas County Fire and Medical. This is a work session, so no action will take place during the work sessions for informational purposes only. If you'd like to provide public comment on the information that you hear during this work session, you're welcome to join us at our 5:30 business meeting and provide your comments during our public comment section. And with that, I'll turn it over to. We're hearing that we do not have sound on Zoom. If you could raise your, no, please don't.
This is Carrie and I can hear you.
Carrie can hear us. Okay, I guess we do have sound on Zoom. So Sarah, is it okay if I hand it off to Chief Llewellyn? All right, Chief Llewellyn, welcome. We're excited to hear what you have to share today.
Thank you and good afternoon. I'm Chief Rich Llewellyn with Lawrence Douglas County Fire Medical. I see I picked the wrong seat because I can kind of see my little bald spot in the back of my head from this camera angle. But we're excited to be here today to present kind of a recap of 2023 and a look ahead to 2024. And I have with me a couple of our team members with LDCFM. I have the Division Chief of Emergency Medical Services, Kevin Joels, to my right, and Mackenzie Azell to my left, who's a data analyst right now, but really filling a role as I would say a little higher level role that she has been in for the last approximately year and a half. So excited to be here and present what we have for you. I'm going to share my screen. And I believe there'll be a little bit of a pause as the systems think about it. All right, there we go. And looks like everything's going well. Okay, so we'll move on to the next step. We did want to kind of highlight, give kind of an upper level highlight of 2023 activities and particularly as they relate to our partnership with Douglas County and how that relates to the city of Lawrence. Because with our joint agreement and joint relationship, joint governance relationship, it I think has really, in my mind, since I've gotten here, kind of brought the two entities together, even in my short tenure. All right. There we go. The first thing we wanted to talk about with you is a new tool called the Kansas Wildfire Risk Assessment Portal. This was released this year by the Kansas Forest Service. It's a tool that allows both agencies and homeowners the opportunity to look at their, for us, it's a jurisdiction. For a homeowner, it would be their property at a granular level. It includes some wildfire risk assessment, it includes some values assessment, historical fire experience. The link to this is down on the bottom right, and dare I ask, would it support looking at this?
I think you could close it and try to pull up your own internet.
Okay.
And share your screen that way, if that's what you wanted to.
Okay, let me just try that real quick, because there is, I think, value in looking at this portal. I did present to the commission the report that was created specific to Douglas County, and it talks a lot about the different categories of acreage in the county. So there are a couple different aspects to this. One is for folks who might have the need to have a little bit more data, including fire departments, county agencies, police departments. And so they can get into the pro version. This is the launch screen, and if you click on launch that, you can see okay, let me share my screen again. Sorry about that. There we go. Go back. All right, so this is the launch screen that you're looking at. What we can do is click launch there, and you can see the two different versions, basic or advanced. Anybody can get into the basic. You need to have an account to get into the advanced, and you see the kind of categories that are there. So if you hit enter, you're left with this map of Kansas, and you can zoom in and scroll a little bit, and you can scroll around the map and look at some different categories here in Douglas County if you want to see. One of the interesting categories that I think, if you look up at map themes at the top, click on that, is the fire occurrence density, and that looks at the density of historic fire occurrences that have been reported. And you'll see here on this map, the areas in dark red are have the most occurrences of fires, and the areas in light green have the least. And these really make sense when you think about most wildland fires are caused by humans. And so those areas where there's a lot of human activities are going to show a lot more fire activity. If you want to look at the wildfire risk, you can look at that. You could enter an address if you were so inclined, and zoom right into your location, and it's categorized here as, I think, minimal through extreme. So the white is minimal, the red is extreme, and it is down to a 30 square meter granularity. So are there any questions on that portal? Okay, I'm going to skip back over to our.
So I assume this is mostly based on vegetation cover, which would change like from season to season in terms of like CRP ground is showing up as, a higher risk factor and such.
Yeah, it has to do with both vegetation, but also slope angle. They look at the angle of slope and in terms of difficulty of suppression. So an area that has hills or gullies is going to be harder to access for suppression. So that's going to change your risk factor. And an individual homeowner could create a report specific to their property or location.
I was sort of surprised looking at it when I think about wildfire within the city limits. I think that would be relatively low, but there's a lot of red within the city limits. Can you talk about why?
Yeah, that has to do with our categorization of fires and fires that we relate to vegetation. So if there's a fire in a small field, it's going to be categorized as vegetation fire and caused by fireworks or a discarded cigarette or even sunlight shining through glass. And because of all those human activities that are there, there's a much more likelihood or a higher likelihood of a fire occurring there. And there's been more experience of that. Another factor that you might consider is the reporting process to departments that have robust reporting systems are going to have that data captured in the system. Whereas if somebody has a wildland fire on their own property and is extinguished and they never called the fire department, you're not going to see that in this report.
So controlled burns that don't result in a fire response would not show up on this map.
That's correct, yeah. There is also a layer in there for large historic wildland fires. So some of the fires that have occurred in the southern part of Kansas in particular, I know, are in there, and you can kind of see the old burn scars and see where those are. All right, I'm gonna switch back to the different screen. I need to stop share here and then share again. And there's a little bit of lag time, it looks like, with screen sharing. There we are. The next thing we want to talk about is highlight our reaccreditation in 2023, talk about some of the impacts to the organization, how we're communicating that internally, and what our roadmap forward is, and when the next time we're going to be reaccredited or be ready for applying for that process.
Awesome, and I'm going to take it away from here to talk about accreditation. And so I have our accreditation report that I was going to pass around for each of you. It has all the details in the world about our process and the findings related to our documents. And so just kind of a brief overview, we were given accredited status once again in the spring. We went before the commission, but before how we kind of got there, we were an accredited agency beforehand. We started really digging into the documents and updating them last summer, really last spring. And so through the summer and the fall, we were doing a self-assessment manual where we looked at 250 performance indicators, looked at what the department was doing, how that was going, and then a plan for the future. And so within this document, you'll see 11 categories. Those categories look at all pieces or aspects of the department. And then each category has performance indicators and core competencies that we write to. So it just gives it a little bit of framework to organize it. So we updated that document as well as our strategic plan for the department and the community risk assessment standards of cover, which has some recommendations in it that we'll see follow through the process with us into this accreditation report. Last winter, we had a site team from the Center for Public Safety Excellence on the Commission of Fire Accreditation International come to our department, to the city of Lawrence and Douglas County, and they were on site to verify and validate everything that we had written for our 250 performance indicators. And so this team was able to meet with us and see our facilities and have meetings to go over some questions related to those answers to the performance indicators. And then at the end, they noted that they were going to be recommending us to the commission for accredited status. With that, it's typical to get anywhere from 10 to 30 recommendations from your peer team. This is just in the spirit of continuous improvement. So we received 20 recommendations, and in that packet, those recommendations can be seen starting on page 4. And so we have the recommendations, and then there's a reference at the end of each recommendation that ties it to the performance indicator. So each recommendation comes from something that we wrote and something that they saw while they were on site to verify and validate. So in the spring of 2023, we went in front of the commission and fielded questions. And at the end, we're given the accredited status with the plaque. And so here you can see us after that hearing with our plaque, and to kind of talk about next steps with the accreditation process. So every single year, this is good for 5 years. So in another 4 years, we'll be going through this process again. But in the meantime, every year we do an annual compliance report where we will have kind of check-ins and give updates on these recommendations. So each recommendation every year will get an update from LDCFM, be submitted through a formal report with the response data that's from the last year or time period, whatever at that point is in the report. And one thing that we're wanting to do internally going forward is taking this information about the recommendation progress and moving that into more of a readable format for LDCFM members and then also the community so that it's more tangible to see what progress is being made on that. Another thing that we can talk about with accreditation is, so obviously I mentioned earlier that the accreditation documents that lead up into this process are our strategic plan and the community risk assessment standards of cover. The strategic plan has goals and objectives for us. We've also had critical tasks outlined in that. So we do have teams at LDCFM that are working on those items, as well as the community risk assessment standards of cover has recommendations. Some of those recommendations our peer team saw and agreed that they wanted to endorse those recommendations. And so we see a little bit of overlap or shadow within our accreditation report. Are there any specific questions on our accreditation process right now or anything that you guys would like to add?
I have, well, 2 quick questions. One, Assuming that you have an electronic copy of this, can that be shared so that it'll be uploaded to the public agenda
Yes.
after this evening? And then I spot read a few of the 20 recommendations, but not all of them, because I'm not a great multitasker, but I'm curious if there were any that surprised you or that feel like sort of particular challenges for you to really hone in on in this coming year? Or were they maybe sort of expected or along some of the themes that maybe you were already speaking about internally?
Yeah, so a lot of the themes were coming up actually through the creation of our other documents, our strategic plan and community risk assessment standards of cover. One of those items was looking at our planning zones. So when we report our benchmarks and our baseline related to our response performance, we look at planning zones. And so Douglas County right now has some really big planning zones. And through creating this community risk assessment standards of cover, we realized that it might be beneficial for us to reassess that and to potentially break those down, but then also for the city of Lawrence, Eudora, and Baldwin. And so that can not only help us when we're looking at data, but also in the community risk reduction area. So if we were to move forward with a community risk reduction program, it didn't necessarily have to be a blanket program or as big as each of the zones now, but can be more specific or customized to maybe a smaller planning zone. That was one. Another one that I will speak to is some of these are outside of LDCFM because the whole accreditation process looks at LDCFM and all the support or links between other departments or agencies. And one of those is human resources. And so LDCFM has almost 200 SOPs, so like standard operating procedures and policies. We also curtail into the city's policies and procedures. And one of the guidelines for the accreditation process is they have to be looked at or updated, or updated within 3 years. And so most of our SOPs are on a 1-year timeline. The cities, they're moving towards that. And so that's something that we're assisting. We have a few policies with them right now that we're all moving forward together. And that just happened to align with the recommendations that the team saw was an opportunity for improvement as well.
Add in a couple of the recommendations. We're big on my radar screen already, and one of those had to do with outside agreements. And I don't know if I've told you this when I got here, but kind of the fingernails on the chalkboard was handshake agreements. You know, when I asked about formal agreements, it's a handshake agreement. And so a best practice is to formalize those agreements. And that's an area that we're moving forward with and trying to work through some of those right now.
So I had a really great tour of all of the fire stations with this crew right here. And I noticed one of the recommendations, I think you've already made significant progress on, and that was the water rescue. Looks like there's been quite an investment in training and materials and equipment for water rescue. And that probably is soon to be outdated from this recommendation, I would imagine.
Yeah, we hope so. We recently received a grant from the federal government to allow us to buy or provide training to our water rescue team members that will take them to a level that as a team they haven't been at before. We're very excited to be able to do that, but also to be able to do that in a responsible manner that uses available grant funding.
I will also add with each of these recommendations, they were presented to the department and it's up to the department and authority having jurisdiction to accept them. So in the spring of 2023, we accepted all of our recommendations.
Just one thing that I'd like to add too is we have two individuals, Mackenzie and then Battalion Chief Tyler Wade, that are both peer assessors. So they will go and visit. And I think Mackenzie did Kearney? No, where'd you go? Forget.
I went to Lincoln this year, Lincoln, Nebraska, and then Columbus, Ohio last year.
And then Tyler went to Toledo, Ohio, this just, I think, last week. And that's an added bonus for us because not only they're out verifying, validating other people's organizations, but they're learning and able to bring back some stuff too, which makes them better at the document supervision as well. So it's an added bonus for us as an organization. And we're lucky to have them do that because it's quite a commitment because she's not only being our accreditation manager, but she's also reading other people's documents as well. And it's not thin, right? So.
Kristen Eford is another member who's qualified to be an evaluator. She just hasn't had that opportunity yet. You put your name in, and when they have openings, if you're selected, you get to go, and she hasn't yet to be selected. But that is an opportunity that we like to offer to our folks, just for all the reasons that Chief Joel specified. Okay, we'll go ahead and move on to the next slide here.
Yeah, so we've had many discussions over the last few years about mobile integrated health, and we appreciate your support and getting those folks to us and to the community. They started on December 4th. The remainder of this year, these two paramedics are shifting from their past 911 work into this role. So we're essentially, I just heard a term before I got here, we're kind of changing their chip. They are two paramedics that are seasoned and veterans, in the emergency services game, but they saw a different path for their future going forward, and so that's why they were selected for this role. The remainder of the year, they're spending time with our fire folks on the trucks and the ambulances within LDCFM, and then on top of that, we're doing many meetings with county and city partners. And there's a lot of opportunities and some education opportunities for them to gain understanding of this new role, because it is different. We want to make sure that every opportunity that we can handle and their bandwidth is at least explored. And as we go through 2024, we give them the opportunity to try some things out to better serve our community. Our first goal is to reduce some of the high utilizers in the community so that we can connect those resources. And through some of the work with My Resource Connection, Douglas County My Resource Connection, they're finding a lot of avenues to be able to make those commitments. And so they're excited. They're as excited as I am, but we're also a little bit of trepidation to just start showing up at people's houses and saying, hey, you need some help? And so we're just taking a little bit of time. They rode with a neighboring agency, Olathe Fire, yesterday, and rode with their mobile integrated health program. It's a little bit structured a little bit differently, but they learned a lot, and they're looking forward to some other opportunities in Kansas. One thing that we were able to attend a couple weeks ago was the Mobile Integrated Health Summit, which was held in Topeka, Kansas. And I was expecting it to just be EMS providers there. And I saw Jill Jolliker there. We saw several folks from Heartland Community Health. So it's good that it's on their radar as well, because I don't think a few years ago it was that big a deal in this community. And so we're looking forward to 2024 being a big year for us.
What are some of the metrics that you're covering for that program, and when we maybe have enough data to report something back, because I recognize it's going to take a while to step it up, and then it just started?
Yeah, so I respectfully shrug my shoulders. I don't mean that we don't have any plans, but really, we really have to find out what we're going to be able to do. We are in a situation where community paramedicine can be very, very useful in the community, but when you don't have a mid-level provider, it stifles you a little bit. So I don't know that I have an answer for you yet on that. I do know that through the My Resource Connection, there's a community outreach referral form that we get referrals from either our firefighters and paramedics that are out in the streets, and they just send that and it'll go to My Resource Connection. And now Mobile Integrated Health have access to that, and they get an email every time that gets filled out. And then that's going to be where we're going to first start making contact with those people that are in those that are being referred. They don't have to take services. There's no requirement. It's just an opportunity for them to get some connected resources with all the agencies that we support and that you all support as well, along with the city. I know you have another question, so.
It's related. When can we circle back with you and ask again, like, when do you think you'll start defining like what the metrics are and what the goals are for the program? Because
I think by March, we'll probably have a really good understanding of what they're going to be able to do. We have a vehicle for them. We purchased a vehicle, or we requested a vehicle. We haven't received it yet. So they'll use a different vehicle in the meantime. It's not going to be labeled and noticeable by any means, but it's an opportunity we don't need to be flashy with this program, but we want to certainly be, we want to share that we have a program because it's part of LDCFM and we're proud of it. But I would say by March, and you can feel free to reach out in January and February as well. I just don't know that I feel comfortable saying that they're going to do something until we have meetings with the hospital tomorrow. We have meetings with Heartland Health on Friday. Next week, they're going to ride with KCK Fire because they've got a mobile integrated health program. So this is just a growing and a learning opportunity, looking at some possible education, 2-week education in Missouri in maybe April.
One of the questions during our interview that I asked both of these individuals is, how do you handle uncertainty? Because we're building a program, we don't have a checklist, right? We don't have 10 things to do to launch a MIH program. We have an idea, we have a vision, we're going to need to iterate, and they need to be a part of that. So we're excited to have them on board. They both indicated that they're okay with that uncertainty and that change. And we just had them on today. They observed a meeting with our Government Performance Lab cohort through the Harvard Kennedy School that is working on kind of defining how we, interact within Douglas County, how we break down those silos that may be keeping us from seeing the same people or sending the right people to somebody who needs a different service than they're getting from whoever's there. So they're starting to get dialed in on that process as well. So we're excited to see this program grow over the next 6 months.
Commissioners, I was just going to add, some of the things we've talked about in our project team. Kevin and I've had a project team going that's met just about every month with the different stakeholders. He's kept everybody up to date on efforts, and I think his approach of sending the team out and learning what's available now, so they know that they're filling the right gaps in services and making the necessary connections. But one of the immediate things that I know we've talked about in our project team to try to track is, you trying to see a decrease in lift assists. And that's going to take a little bit more finessing in terms of how to integrate the MyRC data with the other unique systems that you all have. But one of the goals we've talked about in our weekly meetings that we have to look at those referrals from the MyRC community outreach referral forms is doing an analysis similar to what we presented to you all with Artists Helping the Homeless recently. So trying to understand the impact that that referral mechanisms had, the impact that Project Lively's had on the investment that the county's had in Project Lively, and ultimately, now that I think, it sounds like 2024 is going to be the first full year that MIH we can really have like a good year's worth of data to track back to and look at that data. But that's how we've looked at it historically. And Dr. Cravens has been a part of that project team. And I really think that Kevin's tried to make sure that they're filling a necessary gap, but it's hard to know what that gap is when we have so many new things coming online. TRC, the mobile response team, co-responder, all these things that are available.
Yeah, we know there's going to be duplication. We just want to try to keep that as minimal as possible. And we're okay with duplication because then we know that those people are being contacted. And but if we were just to go do it without these contacts, we would really be wasting our time. So everybody's time. So we're being very mindful of that. And like Jill says, on Mondays, every Monday for the last, I want to say 2 years, I guess, maybe it feels like less than that, but 2 years or so, every Monday, nearly every Monday, we're meeting about these referral forms that come in every single week. It may be one or two, but they're typically, if the person is over 60, they qualify for being contacted by Project Lively. Under 60 has always kind of thrown a curveball at us, and now we have that answer. And so this is exciting for them, and they'll start being on those meetings every Monday, and I might get my 2 o'clock back on Monday, which is the goal.
Well, and there's a subset of folks that, even if they are referred to Project Lively, aren't always open to working with Project Lively. So that's where, if this team can build some trust and do some work in the home, maybe that gets them to that point. The other thing that I know we've talked about, when Kevin talked about talking to the hospital soon, what we heard how other communities have approached this work in terms of understanding the impact and whether or not it's doing what we'd hoped it would, is looking at the readmission rates for folks in and out of the hospital and really understanding how much savings they're experiencing because of this. So that's something very early on we talked about with this program, that we suspect that it will help the hospital's bottom line as well.
And all of that data is helpful for us as we communicate about programs like this to the taxpayers, to make sure that kind of we're looking at what value it is that the community gets back from it, and that's both a human value and a monetary value. So I appreciate the move towards towards that, and I recognize that starting off a program, we won't have that right away, but that's a great direction to be headed.
Well, just looking at some of the folks that we look at on these referrals of how, some folks that have had a lot of visits from EMS crews in the course of a week. It's a lot of money. And I think the referral forms come that we look at because the EMS teams get really burnt out on going to the same folks over and over again, and they're not able to help them, and there's something else that's needed, and we're not always able to realize that, but maybe this is something that can help some of those folks.
Yeah, I'm positive, but I'm fearful that once our folks, our LDCFM online suppression and emergency services folks realize that they should have been filling out that form, that they haven't for a long time. I've told them, and that's certainly not a dig, because well, we're going to do it again tomorrow, whether I fill this form out or not. I fear that what's going to happen is they're going to realize that there's an answer now, and that they're going to be referring a lot of people that have never been referred before. And so we're going to have to really triage people and sort that out. So it's a blessing until it becomes a curse, but we'll meet that road. And then just to address your data concern, I expressed to them today, specifically today, that there are some agencies that have a mobile integrated health program, whether it's a different part of the country or locally, that don't really care much about data, because that's not how they get supported. But I made sure that they understood that you all do, and we get it, and we do. We talk about data. We talk about data every day, and so they'll be plentiful. It'll be plentiful.
All right, we'll move on to this next slide, and if I could figure out the timing, I could do this, and then we'd miss the lag time. All right, one of the projects we've been working on really for more than a year now, since shortly after I arrived, is reconfiguring our deployment matrix so we get the right resources to an incident. Currently, a small single-family home that's experiencing a fire is going to get the same initial response as a 10-story dormitory that's experienced a fire. And those are very different incidents with very different resource needs. And so it's important for us to get the right resources there. One consideration of that is our ability to field a large number of resources that might be required. The NFPA has looked at specific numbers for certain types of incidents, and a high-rise fire should get about 42 firefighters there on the initial alarm. That's more than we typically have on duty in a day. So we get as many there as we can, but we need to find those resources and develop those agreements, and that ties back to the recommendation from the peer accreditation team as far as formalizing those resources. So we've been working on getting those agreements in place, working through the legalities of how to sign and get mutual and auto aid agreements in place. We have one that we're working with the city attorney's office right now. That'll be our first mutual aid agreement in 25 years, actually 26 years now. So not only with the cities that surround us or jurisdictions that surround us, but also within Douglas County, because we don't have a countywide mutual aid agreement for just fire responses.
I'd be really interested to see the whole of the matrix. We have A through F in terms of calls here, but I actually did dig through the numbers and found it very interesting. If it's possible to share that, I'd be glad to see it. And of course, it differentiates between a response in the city and the same call response in the county, because the county responses anticipate that there are, volunteers that are coming to that too, so personnel is less of an issue. So just flagging that.
Yeah, I appreciate that, and we can get that for you. Also, I'd like to identify that we are working with our county partners. There's interest, I think, in some other jurisdictions that we've talked to in the county in developing a system like this. Ideally, we could get it so it's easy for the incident commander who may be overwhelmed by an evolving incident and not have the time or experience to say, hey, I need 2 engines from this jurisdiction and a ladder from this jurisdiction. If we can just create those alarm levels and say, give me another alarm, and that translates at dispatch into 2 engines and a ladder, then that's going to remove that thought process or the requirement to have that thought process from the incident commander. And I think that's where some of the other jurisdictions have some interest, particularly with maybe potentially less experienced folks who are running incidents.
I will add that this deployment matrix reconfiguration came from the work that we did within the department for the community risk assessment standards of cover. And so critical tasking, which is where this ended up coming from, like right sizing that deployment, that was done internally. We had at that point the technical advisors program come in and facilitate that and teach us a little bit more about how that process works. And then this was in more of a draft form than it is right now when our site team came on site. And so they were able to see this, ask some more questions. We've met with the Douglas County Emergency Communications Center. We know that they're looking at some changes as well. And so we're working with the County Fire Chiefs Association and the ECC to figure out timing of when either all of this or part of this can be implemented and make sure that it works for all the agencies involved.
So just because this is data that the public has access to, can you give us a bit of a time frame? You know, what are we looking at here? As Commissioner Willie said, it only goes through F. Is this a month worth of data? Is this a year worth of data? Is this a week? What are we seeing?
So what you're looking at is the number of people that we're going to put at each of these incidents. So this is, these are what we believe are the resources that are needed to solve the specific types of incidents that are there. So they're not actual events that have occurred. These are just the number. So if you can look at the abdominal pain on the top, we think 1 medic unit can handle that with 2 people. If we have an aircraft emergency, and you'll see those are differentiated between city and county, because in the county, we would be responding for medical and extrication purposes. But in the city, we believe that 14 people would be necessary to mitigate that incident. So that's where those numbers come from.
That's really helpful, because I think some people may look at it and say, these are the incidents that happened, right? And this is how we responded to it, rather than it being what we hope to see moving forward.
Yeah.
Okay, thank you.
Yep, and then if we were to pull back the curtain on this, we would see all of the teams work on what those 14 people are actually doing and what they're assigned. So we did break it down with the technical advisors program and with our peer team and internally to make sure that we're right sizing that. So this is, yes, just the response.
This is aspirational, where you're hoping to move to, not necessarily how we deployed today.
Correct. And
That's
so
correct, yeah.
what we deploy today can be seen in the community risk assessment standards of cover from 2000, I think it's 17. So this will be updated in our new document going forward.
And since we're talking about deployment, one of the initiatives that we've had is to increase EMS coverage in areas of the county outside of Lawrence, and in particular with our resource that's in Baldwin City. If they're up in Lawrence for training or administrative purposes, we're attempting to backfill that station down in Baldwin City, and it has had a success with experience in cardiac arrest that the backfilled ambulance was able to get to quickly versus one that was dispatched from Lawrence.
And I really appreciate that is a change in policy to backfill into Baldwin City, because it's just so far from the hospital, their response zone. So I very much appreciate valuing our rural response that way.
Yeah, and that is definitely a factor, the response distance and time to get there. And we are looking at other areas as well. Eudora is a consideration for us with Medic 12 being out there, and but we do have Station 2 that's closer than Station 5 would be to Baldwin City. All right, next up, we're going to be talking about our 2024 budget, both proposed and amended. And we're still waiting. There we are.
So in the interest of time, we'll briefly go over this, but what I just handed out was the memo that outlines the last time we were here in front of you guys. It was kind of like in the middle of another budget process, and it was just very messy. So to kind of summarize the process, we have Chief did a memo for Sarah that showed the proposed original and then also the 2024 adopted. The one thing I will highlight is on the back page of that memo, we do show the budget reductions. And so last time we were here, we talked about kind of the surprise of reductions from the city's process and timing with the county's process. And so we did decrease funding and operating expenses, repairs and maintenance, and non-vehicles, vehicles and equipment, wearing apparel, non-capital equipment, licenses, dues and subscriptions, education and training, fees related to LDCFM's parking, rentals, leases, software, and computers. But we also have our CIP where, it's the approved CIP projects. And so that's the second paper that I provided. One of them just shows for 2024, if we're talking about immediate projects that we'll be looking at. And then on the back, it shows for the next 5 years for the city's CIP plan. And so we work with the county to align what expenses are going into their budget where, because I know our capital projects are kind of named differently.
I think what would be helpful, Mackenzie, moving forward is to break then out the 25 columns and out by city and county by those percentages. And then my assumption here too then is with the station expansions, there's a operational expansion too with staffing, right? So I think then your estimates, the best you know of, how many additional paramedics, firefighters are going to be required when that station opens in 2027. And I know you're not going to just hire them January 1 of 2027. You're going to begin hiring in 2026. So I assume at least.
Unless you want us to fire them next year.
Yeah. And so I just think trying to know how the detail in that phasing to let folks know that those are pretty substantial numbers in 2026, both in terms of capital and operations.
Perfect. We'll add that to our budget documents for the 2025 year.
And we've been talking in our governance meeting about the kind of the process of developing our budget and presenting it to the two commissions and starting with one, coming to the other, going back and back and forth, and the challenges that presents. And I know we experienced that when we had what had been proposed, and then we showed up with one that had been already cut. So we're going to work within the governance structure to get that timing a little bit more refined and get numbers to you that are as up to date as possible, and hopefully not on July 4th.
And in the interest of minimizing surprises, the more you can give us a heads up on that timeline is much better for us to be able to kind of wrap our heads around what we think we might be accomplishing with the next several budgets and how we communicate that to the public too, because by funding some of these things, it means other things will not be funded. So it helps give us just some guidance.
Yeah, that's helpful. One thing I will mention is that our governance meetings, we've moved to quarterly, which has been really helpful just as far as communication goes, like talking about processes like the budget process. We also have representatives from the city of Lawrence, the finance department specifically, that we have not had before. So that's been really beneficial when talking about how do we crosswalk both of those budgets.
So just coming to the slide that we've got here and the adopted so the adopted revenues are higher than the proposed and the adopted expenditures are lower. Can you just talk through those?
Yes. So when we went through cuts within the city's process, most of that was within shared. It did not, and I could I don't want to misspeak because I don't know the super specifics, but how the breakdown works is if things increased on the Douglas County side, or if they even stayed the same and didn't get cut, but the City of Lawrence, the fire only did, because I know that we cut some things just from the City of Lawrence fire, that wouldn't have impacted the projected revenues that Douglas County had within the shared agreement with the shared bucket and also the EMS 100 or 100%. So that's what it's related to. But I also say that, and now I'm realizing what I'm actually saying. Good question. Let me come back to you on that. Sorry.
My assumption there, Mackenzie, is that, I mean, the 9.4 is what they're showing as revenue from Douglas County. So that's our tax support.
And I assume that the difference between the proposed and the adopted were those additional positions that came in after our budget process was over, but City of Lawrence had made a decision that we were then bound by. So
Yes.
that's that dollar difference.
Correct.
Thank you.
Any other questions on this slide? Okay.
So in the interest of time, are there any questions specifically to this timeline that are tripping anybody up?
Yes?
I felt like I maybe knew that was going to come, so that's why I asked.
Yeah, I'd just like to see an updated one, because I know last we met that the two ambulances set to be purchased in June of 2023 had not been purchased by June. I'm not sure when they were. And then I know there's another 6 that were listed for 2023. If you could just kind of walk through when and where those are occurring.
Yeah, so right now, I do believe that they may have been purchased in June or July, like it says, they just weren't online. I think they had arrived. I don't remember the exact date that they had arrived, but they were here but not in service. Isn't that maybe the?
I was talking about the blue, the purchase, not the
The blue,
delivery.
no. So no, that is not, you're correct. So we've been waiting to, the 2023s have been ordered. Because of COVID and the supply chain, we're encumbering money. So the ones that we received in June or July was 21 money. The ones that we'll be receiving, it says December here, but it'll be early January, will be 2022 money. So there was nothing ordered in 2023 because it was preceding my purchasing of doing these ambulances, and it just wasn't done. So we're back on track by the graces of the vendor, because the vendor is allotting us some of their demos. So as opposed to them using these chassis to sell their product, they're giving them to us so that we can stay on our timeline. So those have been, we are still waiting to get some approval, because the reason that this timeline goes out so far is because we're essentially wanting to buy ahead. We can either do one of two things. We can have savings by buying ahead, which is not typically done. Or we can at least get in the hopper so that we're ordering them. I just had a conversation with the vendor today and said, what if commission is not willing to commit to some money that's not there yet because of financial instability in the future? What would be our requirement? He said, as long as the contract's written appropriately, we can get out of that and somebody else will just get it, but we can't say, well, never mind, we found the money, we want them back. So we would just be behind the 8 ball. But historically, we bought 2 every year. It's a good timeline to be on for 6, a 6-year rotation. Sometimes it falls into a 7-year rotation depending on the year and the make. But it's our goal to stay on this 6-year timeline of replacement because of costs that are associated with vehicles that have over 100,000 miles that are of that weight and of the duty that we ask them to perform. So
In our 2024 budget, we approved the purchase of 2 ambulances, but this isn't showing any in 2024. Is that part of the 6 that is listed in July?
Yeah, sorry to interrupt you. Initially, you're right. This does need to be updated because we just recently found out that they're going to give us the demos. So we will be able to get some in 2024. It'll probably be, it's really going to end up probably being the beginning of 2025.
I think that'd be helpful to see whenever you get a
Oh,
chance.
yeah, we'll update it and send it out. If there is something that's confusing about this, please tell us to do it differently. It's a lot of information, and when you're encumbering money and you're going backwards and trying to show that when we're already in the future, then it made it a little difficult to really display, but please let us know if it's confusing.
No, I really like the way it's put forward, just as long as it's
we'll update it.
updated, but no, I think it's very clear.
I do have a question about the July 2023 6 ambulances ordered. Are those associated with the expansion?
So really, that needs to say 7. So we'll update it, and we talked about that just yesterday, actually, maybe the day before. The vendor was in town, so we had a conversation about this, and he sent us some updated numbers because every day these things go up, right? It's not in our control, unfortunately, but we did not have the expansion included on this 6. The 6 is essentially for 25, 26, and really now 27, because this has been pushed to next year. So,
Okay, so this is just pre-ordering
yeah, that's what I'm
the
talking about.
ambulances that will arrive in 25 and 26 and 27.
Right.
Correct. And they have not been ordered.
They have not been ordered. I do think we should, in the effort of saving money, I would like to say we should try to pre-order them. And that'd just be a chassis. But I think that's a conversation for a little bit. I mean, today we're running out of time. So we will update this, and then when we have questions, we can answer those a little bit better.
Go ahead.
I'm reluctant to say anything more about this slide because we are at time almost, but just a point of clarity maybe for the public and media, that these are, you said the word replacement, but that's not necessarily reflected here. We are not just adding new ambulances and increasing the volume constantly. We are mostly replacing ambulances on a regular basis. Correct?
Correct.
Okay.
Did I
I
say
just wanted
something
to
other
put
than
that
replacement?
point of clarification because it's not how the slide reads if you don't have any other context. And I just wanted to say that on the record, I suppose.
Yep, this is in alignment with the status quo of what LDCFM has been doing. And it's just the thinking of it in a different way to be proactive and to be planning. All of this will still go through the same CIP process in the city. So there's no new ones except for the expansions that are already approved through the CIP.
I think it's probably helpful if you are going to update it to go ahead and layer in the CIP ambulances as well, because I'm worried about cash fund balance for you to even place the order. So, because like if you're encumbering the funds, in essence, that's a liability on the fund. So we need to talk through some of the specifics of those pieces because we don't have $3 million in that fund right now. So we need to talk through what is required for placing that order. And in terms of when you say encumbrance, I'm not encumbering those funds. If it means you're placing the order, then that's fine. But we just need to talk through that.
I think we can also put replacement ambulances instead of new ambulances when they're going to be replaced. So were you good there? I tried to time it and it actually popped up quickly. We need to update our transport fee schedule. The EMS agreement between the city and county advises us or requires us to update that every 3 years. It appears that the last time it was updated in 2018. So we'd like to get that done in the first quarter of 2024 to go into effect in 2025 so that we can time that with the budget cycle. So be looking for that for the first quarter of 2024. We've talked a little bit about new stations. We have a growing community and expanding footprint. Our last new station was Station 5 that opened in 2006. Since then, we've had a 74% increase in run volume. The station expansion study or station optimization study identified the need to provide coverage in 2 new areas and then replace a station. Station 3 up on 6th is approaching 60 years old, which is about 10 years past the average life expectancy of a fire station. So we are in need of replacing that. In the CIP budget, we do have the start of a Station 6. We're starting to look at areas. There's a need on the south along Iowa, and there's a need in the northwest part of Lawrence. I asked for just one station, where would it go? And the south end was kind of the first one that we're looking at. There's something I'm going to talk about on the next slide that may influence that a little bit, but that's what we're looking at right now.
And I know we don't have this data in front of us now, but we had talked about, one of the things I'm curious about is where does new station location, what impact does that have on rural response times also? So not just the 4-minute response time, but also beyond that into like the furthest reaches of the county.
Yeah, that's a good point. And both of these new stations will be on what is currently the edge of Lawrence. I think that's where Station 3 was when it first started. Someone who worked there in 1966 said there wasn't anything past Station 3, and you've seen how the city has grown up past that. So we're looking for a couple of stations that will be towards the edge, and one would be serving the northwest part of the county, and the other would be covering that southern part between Lawrence and the Baldwin City Station.
And mostly because medical is what falls under the county's jurisdiction. I'm curious about the 74% increase in call volume. If that is, I would assume that is mostly driven by medical calls as opposed to mostly driven by fires. That's my assumption. Are both of those rough categories up by 74%?
I don't have that data. You have a comment on that?
We've looked at it before, but last time we looked at it, it did seem like it was pretty consistent. EMS did have a little bit more of an increase than all the other fire-related or hazmat or tech rescue calls, but it was pretty balanced.
So I'll just pop the next slide up here while we're talking about this, and you'll see in conversations with the Kansas Fire and Rescue Training Institute, which provides fire and rescue training throughout Kansas. It's headquartered here and associated with KU. They are interested in a facility. They need land, they need space, they need to cover up some of their apparatus. There's a rolling stock that they have that's parked along Bob Billings. If you're driving through there, you see the red apparatus or the red trucks that are down there. Those all belong to KFRTI, and they are experiencing annual rat damage, I think is the best way to describe that. So they're looking for indoor parking and are interested in co-locating a facility with us. So that would be an opportunity for us to save some money on land purchase, some money on infrastructure development. There are, obviously pros and cons that need to be weighed, but they are interested in that partnership.
The rats explain why they changed from loading the grain rescue trailer with grain to loading it with plastic pellets.
That does make sense. Any questions on that? I just met with their new director last week, and they are interested. We'll talk about the next slide that you'll see in a moment is hiring 14 new employees. We're in the hiring process right now. We are going to change our training just a little bit. I've asked the training division to include wildland training, wildfire suppression training into their training mix. So we need to increase our capability here at LDCFM, and that's one of the things that will benefit both the city but also our partners within Douglas County. And some initiatives that you'll see coming in 2024 is we're going to need to review and touch the 2021 EMS cooperative agreement. It's set to expire at the end of 2024, so we're going to have to go through that again and renew that. It is already, yeah. And then we'll need to start early in 2024 discussing the successor agreement to the MOU with Local 1596. That's also set to expire at the end of 2024. So we have a couple big contracts to discuss, both in terms of governance and in terms of labor. And the last slide is, it'll be up in a moment. It doesn't appear to change as fast when I'm thinking about it, so maybe there's a quantum computer here, but is a thank you. So if you have any questions, happy to ask them now, or happy to answer them now.
I don't have any questions. I just wanted to make a couple of comments, which is the two things I'm really excited about. One, to hear the update about and sort of preview of more conversation in the coming year about the mobile integrated health. And I've been eager to hear more about that. And I want to just affirm that uncertainty is okay and honestly a very positive thing. So I'm grateful that you recognize that and can articulate that that was a conversation you had with these seasoned dispatchers and folks in our community who know our community, which I'm also really excited to hear about, and that there's some openness to exploring and assessing along the way. And I think that's really necessary, and figuring out how to right size it to this community. And like you all were saying, really find the appropriate and necessary gaps to try and fill while minimizing that duplication of service. I just appreciate that intentionality, and am assertive outreach is new and feels uncomfortable for lots of people, even like seasoned social service organizations. Doing sort of assertive outreach efforts feels a little weird at first, but I think it's really powerful too, and it just reaches some people differently and more in a more impactful way than sort of other traditional ways of interacting with folks or experiences that are not sort of intentional and with the upfront idea of reaching out and just being visible and accessible and available, and doing that in a consistent way. I think I'm pretty confident is going to make a big difference in our community. So I just appreciate you all wading into those waters and knowing that they might be a little non-traditional and a little scary and murky because you can't really see what's right in front of you. But I'm excited about that. So thanks for diving into that. And then I was also really just happy to see and hear some of the conversation around that deployment reconfiguration, and thinking through that really intentionally, and being mindful about, standards are important, but they're also, you need to be able to assess those and find some flexibility and modify along the way when you realize that maybe some standards have been too restrictive or problematic, or created more expense or energy output than is necessary. So sounds to me like you all are really even though there's a lot of upfront work and all the changes that I think you all are in the season of doing, that it's generally about working smarter, not harder. And I'm very pro that. So I appreciate that, how thoughtful I can tell you all are being and assessing things and modifying along the way.
Likewise, just a couple of comments. I'll visit offline about, I'm interested in some of the cons of a collaboration with Kansas Fire and Rescue Training, but we don't have time for that now, but that would be, I'm just sort of interested in that. I really do appreciate just the update on the whole. I think oftentimes when LDCFM comes to us, it's around the budget time, and we look at a lot of data, and here's the demand for it. And I want to commend you, Chief Llewellyn, for engaging with the county. I think sometimes the county has felt like an afterthought in the agreement with city and county. And since we're such a large partner in this, I really appreciate that thought. An opportunity is, I would have loved to have more data in this report. It's a lot of what we're doing, and love having the accreditation report, but I'm interested too in the numbers behind it that led to their recommendations. I think that helps us better understand, and as Commissioner Willie said, better communicate with the public where that recommendation comes from. We talk a lot about how important accreditation is, but understanding what metrics are driving that accreditation and the metrics behind them is something that I would love to see in the future, and welcome you back at any time to share those with us.
Yeah, we're excited to be here, and I do appreciate that feedback, and I'm interested in making more appearances, and I know Sarah has also expressed that. We're happy to come and present.
I will also note, just for some immediate gratification, later on in your accreditation report that you have, you can find some backup information about each of those recommendations that's more expansive, like it's expanded. But we can also look into the self-assessment manual that I was mentioning and those other documents, and find a way to group that information together to back those recommendations up, to kind of tell the story of how we got there.
Great, thank you.
Just a big thank you for being here and answering my questions, and just appreciate the attention that the county is getting since you've been on board. It has been a noticeable change.
I appreciate that, and I do appreciate the engagement that you see from the county. I think that helps with that relationship, and I think that is reflected in the governance meetings that we're having as well.
All right, if there's no other comments or questions, we will adjourn until our 5:30 business meeting.